So what are we referring to when we're talking about comprehensive dental care? Truly, this is what dentists are taught in dental school. It's a thorough assessment. It starts with an intake process about the patient's medical status. How healthy are they as a person? Any medications they're on, any past surgeries, their overall health status, their dental history, what's happened to them, how has this affected their lives, what are their challenges right now with their dental function, what is their ultimate goal with respect to their dental care. I think when we get through that initial intake, then we go into the clinical arena on a thorough exam and start looking at the health of the system, the jaw joints, the bite, how is it all functioning? Is there premature tooth wear because of TMJ problems? Is this patient in pain related to their jaw? How is the whole system functioning? Are there teeth that have been lost? So then the burden of chewing and function has been placed on the remaining teeth. All these things are part of the exam process. Then we look at the health of the support tissues. So that would mean the gums, the bone that's around each individual tooth. Is it inflamed? Is it in a chronic inflammatory situation where the teeth are at risk of being lost from periodontal disease? What is the status of each individual tooth? Some teeth might need some repair to help them stay intact. Some teeth are great and they're fine and we can count on them and they don't need any help at all. Maybe some teeth have too much disease and they need to be removed. This is all part of the diagnostic process, which allows us to get to a complete prognosis about each factor. And then we can start developing treatment options based on that patient's individual goals to help them get where they want to go. Unfortunately, I've noticed in our profession and probably many healthcare professions, we learn all this great stuff in dental school, but you get out into the real world and there are a lot of factors that can interfere with your time. So your schedule can get too booked, or you can have basically insurance reimbursement that is really difficult to take the kind of time necessary to do this complete diagnosis and treatment plan. What I have come to in my career is that basically I'm not going to shortchange that process. There are exceptions. Sometimes the first time we see somebody, they have an urgent need. They're in pain. They have a broken tooth. They have a front tooth that broke and they have a presentation to give tomorrow. Those are things that you're going to absolutely do a one-off and help them through that crisis. But as soon as possible, I'm going to want to step back and look at the big picture. This takes me 2 hours on the initial exam. That's just kind of how my system has developed. I feel like it's the most important 2 hours that I will ever spend with that patient. And it's worth it. And they're worth it. Maybe it's not for everybody, but if this sounds like something that would be helpful to you or of interest to you, please give us a call. We can walk you through what that looks like and maybe help you get to your ultimate dental health goal.